Hi guys, welcome back to my channel. It is your girl Naika. Today's video we're going to be talking about how my pregnancy became seriously high risk. So let's get started. Okay guys, so story time. Where do I begin? So just to get you guys going on how it started, pregnancy, everything was going well. If you guys haven't seen it already, you're going to see like my second trimester, like symptoms and everything. But it pretty much kind of kicked in my second trimester. I was around 20 weeks and I was going to my 20-week I was at 21 weeks actually. I was going to my 20-week fetal anatomy scan, and that's basically checking everything with the baby all the way down to like the heart, the lungs, the kidneys, everything. I mean, not the lungs, but she knew everything is kidneys, the brain, development, the size, everything. So I'm at my anatomy scan, and of course with COVID my husband could not be there. So, I had to just go through the process and everything by myself. I mean, I had him on FaceTime, but it still kind of took away the specialness of him actually being in the room with me. I'm at my anatomy scan. He's scanning everything with the baby. Everything looks great. It was like, wow, like this, it was like, baby looks great. Baby looks healthy. I think she was measuring around 0.14 ounces at the time, because it's like 21 weeks. She's still tiny, she's still tidbit, but she was like super active. Like the ultrasound tech was like, oh my gosh, she's great, she's moving, but she was moving in the right ways. She was head down, everything looked great. Like I said, her whole body development, everything was on point. I had no negative remarks in terms of her, and it's crazy because when I went into that appointment, I literally said a prayer to myself that whatever it is, and for some reason I had this feeling. And the reason why I'm saying I had this feeling is because about a couple weeks before, I saw this greenish yellowish, like kind of like discharge, but it was like in pieces. And I kept asking myself, like, is that my mucus plug? I spoke to my doctor about it, and she was like, if it's your mucus plug, it'll regenerate. But then at the same time, she told me to come in for an appointment, so that way she can swab me to test me for like an infection or anything like that, because that was like really, the color was also weird, a little bit TMI, but I'm keeping it transparent with you guys. I said to her, I was like, is it normal for a mucus plug to come out early or things like that? She was like, yeah, sometimes certain people mucus plug, but in like pieces. She's like, but she's like, I'm not seeing any signs of anything on the ultrasound. So I said, okay.
Can start recording if you want. See the spine?
She's upside down. What is she doing?
Across. You see?
Oh my gosh. And that's the placenta underneath her, right? Yeah.
Head.
And where's the cervix, if you don't mind me?
This way. See? Baby's like kneeling.
Such a weird position.
But they're constantly moving.
Right. I feel her all the time, because I guess where the placenta is located.
Yes,
she's more to the front, yeah.
But that's good, you feel good movement.
Yeah.
They're changing positions all the time. So the head may be there, then next time could be here.
Right. And the placenta is not covering the cervix or anything.
Well, I'm not doing an official sono, but it doesn't appear that way.
Okay.
Like I'm not doing the transvaginal. So when we do the anatomy.
Right. Oh, the anatomy is transvaginal?
Yes.
Okay.
Yeah. Well, they're capable of measuring the cervix, the technicians.
Oh, okay.
This is just like a basic.
Right. I have
We're
my.
gonna do a detailed survey
Oh, okay. I have it scheduled for the 11th.
of February.
Mhm.
Okay. Baby looks good. Okay.
Mhm.
I said, okay, no problem. She's like, there's no blood or nothing. I said, no blood or nothing. She tested me for infection and I had no type of like infection, nothing like that. She did want to test my blood for anemia, so we did that. But other than that, I was cleared for everything. So that was prior to that. So now in my anatomy scan, I literally said a prayer and I said to myself, God, if there's anything that needs to be discovered or detected for me, please, bring it to fruition so that way we can nip it in the butt, so that way that this pregnancy can go forward. That was like my major concern. The tech comes in and the doctor comes in, checks all the ultrasound, checks the photos, everything that the doctor says to me. I just want to review something with you. I was like, is it possible that my husband could come in and hear what you have to say? Because obviously it sounded like something was going on. So the tech grabbed my husband. He came in the back. We sat down, and then she said to me, she's like, well, I'm looking at your cervix, and your cervix is opening. Your cervix is funneling. And I'm like, what is she talking about? And it made me think about my mucus plug. And then she was like, yeah, your cervix is funneling open. Your cervix is only open by 0.6 centimeters. She said, we're going to need to do an emergency cerclage to stitch your cervix so that way this pregnancy can go to full term, or at least to full term or further enough where it's viable. Because at the time I was only 21 weeks. My pregnancy was not viable yet. Baby's not viable until at least 24, 25 weeks. And even then, that's still super high risk and chances for developmental issues and things like that. So I'm just like, I'm literally laying there and I'm just like, saying to myself, God, you answer my prayers because they're able to detect it. But at the same time, I'm nervous. I'm scared. I don't know what to do. I'm just like, well, not that I don't know what to do. I knew what to do, because when I was concerned about my mucus plug and my cervix, I was concerned about my mucus plug, I was looking up Dr. Google, and Cerclage came up. I said to myself, I know what this is, because I had a friend and I know someone that actually had to get an emergency stitch. But you don't really know too much about it when it's somebody else going through it. When you have to go through it now, you out or feel like you may have to go through it, you end up doing all your research. So this came up and I already was aware of what it was. My husband wasn't aware, of course, but I had mentioned to him, I said, if I ever have to get a cerclage, I'm going to do it, because I've come this far to have this baby. I'm not gonna let anything stop me from having this baby. So I end up having to get an emergency cerclage, which is an emergency stitch that they stitch your cervix closed so that way the baby can sustain and not try to come out early enough. Now with an emergency cerclage, the baby can still try to come early. If your water breaks, you have to go in. You understand? So all of these things you have to still think about. You still got to be precautious. So that was Friday, February 11th. On Sunday, February 13th, I went in on Sunday for an emergency cerclage. I had to get a COVID test from before that to make sure that I was cleared for the procedure. And then after that, they had told me that my husband could have came in with me. But the day of, he couldn't have come in with me because the rules change at the hospital every single day. So I started crying. I was crying because I was just like, I got to go through this procedure by myself, knowing that, he can't be there with me. And the thing is, well, with the cerclage, because I didn't know what to expect, you understand, it was very nerve-wracking for me. And then on top of that, I knew that I had to get a spinal. So I was just like, I gotta go through all of this. And of course, pregnancy hormones, I'm like emotional. I'm like, oh my gosh, I gotta go through this by myself. He's not even next to me. There's that. But I can tell you this, the nurse that I had was great. The doctors that I had was great. I mean, just the anesthesiologist that I had was great. Everything about the process and the procedure was great. So if I end up coming back on this video, it's because I'm hearing baby. Okay, so yes, I'll be back. I'm back. I had to breastfeed real quick. So she's back to sleep. So yes, my husband couldn't come in with me. So basically, when I got there, they put me in like in triage. My nurse comes up to me. She puts an IV in. She did a really good job. She's very tentative. The doctor comes in, tells me, you know, what the risks are, because the risk of getting a cerclage done is, you know, they could accidentally break your water, and then at that time they'll have to terminate the pregnancy. So that freaked me out, but at the same time I kept thinking positive and I had the faith. Anesthesiologist comes in, asks me if I ever had anesthesia before. I said yes, general. Spinal anesthesia before. I said no. He asked me if I had any reactions to anesthesia. Of course I said no. My nurse comes in, she gives me this thing for nausea, because you know, just to help with the nausea, because sometimes you may have reactions to anesthesia. So basically, you know, I was there prepped and ready in my gown to go. They were just waiting for, you know, my time to go into the OR to get everything done. So then the doctor comes in. I had one doctor that was actually one of the doctors at my high-risk office. She was the one who was giving me all the risk and the procedures, and then the other doctor came in and who was actually doing the procedure as well. She comes in, she says, you know, she introduced herself, her name. She's like, everything is gonna be all right. You know, she was like, everything is gonna go smooth. We're gonna make sure we get you to, you know, full term. So I said, perfect, sounds good. It was time for me to go in for the procedure. At that time, of course, I hung up on FaceTime from my husband. I told him go home because it's gonna take some time, because they are giving me spinal, so I'll be numb from the waist down. So that way it's gonna take some time for me to recover. So go home and nap or whatever. So I was talking to him, and I was like, okay, I'm about to be wheeled in. So I got wheeled in, went into the OR. They sat me on the bed. Oh, they actually, before they wheeled me to the OR, they did a ultrasound of the baby just to check to make sure heartbeat, everything like that was good. After that, when they wheeled me in, I was sitting on the bed of the operating table. They had me like this, and of course I had to like hunch over because they were putting, you know, the spinal medication, like, you know, right here. So I was hunched over like this. And then this is where they put the spinal, and they said you're gonna feel a quick burning and a pinch. So I said, okay, no problem. So I felt the burning and the pinch and the burn, and then all of a sudden I felt nothing. And I was like, I don't feel anything. Then next thing you know, I felt my whole entire, from like here down, get numb. Like I literally felt my body just went completely numb. Like my nerves just started to kind of settle. I don't even know how to describe it. Like I just felt that tingling in my nerves, and it just started to settle down. And next thing you know, like I was, like I said, numb. I felt the numbness in my legs. Like at that point, I appreciated having legs, because I was just like, it gave me a different level of appreciation, because I didn't like that feeling. I didn't like the feeling at all. It really wasn't a good feeling for me. After they did that, they grabbed my legs really fast. Like they literally grabbed my legs really fast and laid me on the table. So as I'm laying on the table, they started to elevate the table from flat to tilted. So now my head is like this and my legs are up there, prepping me. At that point, I started to feel nauseous. So I was like, I feel like I have to throw up. And they said, okay. She brought like a little moon-shaped bin, and she put it sat right next to my face. I can't even, like, it sat literally right next to my face. And she said, tilt to the side. She took my mask off, tilt to the side, and throw up in the bin. So I threw up in the bin. I threw up like 2 times. Then she said, then I started to feel like this heaviness on my chest. And I'm like, why do I feel like I can't breathe? It freaked me out. So she said, that's normal because you're tilted. The anesthesia that's affecting your lower body is coming down to your chest. So you may feel a little pressure, like you can't breathe. It's gonna go away in a minute. Exactly what she said is exactly what happened. It went away. Then the doctor came to me and said, listen to me. She's like, I see your blood pressure drop, which is why you threw up. She said, listen, I don't want you to worry. We are equipped with everything. We're literally equipped with everything. So you feel you need oxygen, we got you. Like she just reassured me that we have everything, and they even gave me a nausea medication to settle my stomach, which was great. I couldn't feel baby, I couldn't feel nothing. That was normal because I was numbed all the way down. After that, the doctor said to me, I'm gonna walk you through every step, but I need you to let me know when you're ready. I want to make sure that you're okay. So I said, okay, no problem, that's fine. My husband's home. Then after that, she said to me, she was like, so how are you feeling now? And I said, okay, I feel a little bit okay. So do you think we can start? I said, yeah, we can start. And that I really appreciated, because she was so reassuring, and she wanted me to know that everything was going to be okay. So I took that really personal, and she got really 5 stars for me just from that reassurance. So as I was elevated and I was tilted, they started to do the procedure. So she told me every step of the way. She's okay, we're gonna put the speculum in. And it wasn't like the regular speculum from the GYN office, the plastic one. This was the metal one, the metal clamps. So they used that one, they opened it, and like I said, I can't feel nothing. Then they told me they needed a catheter, because she said, okay, thank God you came in, because she said your water bag is bulging. And that freaked me out, because I'm like, what do you mean my water bag is bulging? My water bag was bulging out, and she said, I think it could have been the effects of me throwing up. It kind of just jolted my whole body. So my water bag was bulging out from my cervix. So they took a catheter, and it was like she gently like pushed the water bag back in to ensure that she wasn't gonna pop it. And I'm literally on that OR table praying, please let this go right. Please let this go right. Please don't let them pop it. Please don't let them pop it. That's all I'm saying, because I'm just like, I can't believe like this is happening right now. So as she put she pushed it back in, then she said, okay, you know what we're gonna do? The McDonald. We're gonna stitch. We're gonna insert a stitch on your cervix, because there's one where there's like a donut that you put over, and then there's one that's like a stitch. Okay, so I guess the McDonald's is the stitch. So she said, we're going to do the stitch, and she's like, your cervix is still long, which is good. It hasn't shortened yet. It was just closed only at this much, but inside of it was funneling, which means like that's how my water bag was able to funnel down through it. So so then after that, she did the stitch. She's like, okay, stitch is done. How stitch is done. I couldn't, of course, obviously I couldn't feel anything, and that was pretty much it. They said it was a success. She said, this is stitched pretty well. She's like, let's just pray that you make it to the end. Then they came in with another ultrasound cart to check baby's heartbeat. She was just like having a whole party in there. She was oblivious to what was going on, even though I couldn't feel her because I was numb from here all the way down. She was having herself a ball in there. She was. And it was like, baby's good. Baby's heart rate was pretty high. It was like 151 or something like that. She was living it up in there, enjoying it, living her best life, oblivious, like I said, to what was going on out here. So then after that, they grabbed me up, and they put like another OR bed like right next to me. They grabbed me up, and then they dragged me over, because obviously I can't feel my legs, so I can't move my body over myself. They had to kind of like, I could move my upper body, but they grabbed my legs and made me move my legs over. So then they dragged me over to triage. I was back in triage, because they basically moved me over to the bed that I was in triage. So so I was back in triage, and I was like laying in there like recovery, because I had to gain all the feeling back in my leg. Little did I know that they put a catheter in to catch urine. And then my goal was to, of course, start feeling my legs again, and to walk, and of course to use the bathroom. So I was laying there. They brought me food, something to eat. The food was actually good. After that, they brought me. After that, the nurse came in. She checked my pressure, like my blood pressure. She kept coming in and checking me. She kept asking me, how you feeling? Do you feel like you have to pee? It was basically the waiting to see if I have that feeling that I have to pee, that the numbness is wearing off. I kept wiggling my toes and everything like that. I FaceTime my husband, told him I was out. He's like, how did everything go? I did tell him how everything went. And he was like, he's like, I told you were in good hands. He's very positive, so he's like, I told you were in good hands. You had nothing to worry about. So, so right now the goal at that point was just to make it to full term. That was the goal. So, after that, I had a follow-up appointment like a week later to check the Cerclage, to see where it is and where it stands and everything. And they did tell me bed rest. They were a little bit more lenient on the bed rest, but my OB, because she was communicated through it with everything. But she said to me strictly, nope, you're going on bed rest. So I said, okay. No problem. She's like, elevate your legs, everything. So, and then they also prescribed me progesterone. So progesterone capsules to insert. So I had to insert, it's 200 milligrams. I had to insert that every single day besides taking my prenatal. And I had, of course, a pain med that I took that it was like maybe like 2 days that I had to take it. But yes, that is how my pregnancy instantly became high risk.
Girl, I see your face everywhere. When I'm going out, you'll be there. 'Cause everything reminds me of you. I can't take no more. Girl, I think I'm losing my mind. Try to go to work, but I lost track of time. 'Cause everyone keep looking like you. I can't take no more.